Hi everyone, Dr. Witt here, your local mobile chiropractor here in Alameda and Oakland, and I'm here today to tell you a little bit about headaches. Did you know that the type of headache you have will actually change the treatment for that headache? I'm going to tell you about 4 different types of headaches that we oftentimes see in chiropractic offices and in our population as a whole. The first type is called a tension headache. So a tension headache usually feels like a deep pressure. People sometimes say it feels like my head is in a vice, and it's oftentimes triggered by poor posture, by stressful situations, people who are experiencing a lot of stress, or by tight muscles in the neck, the upper back, and the shoulders. The second type of headache is actually the best one to get treated in a chiropractic office. And the reason for that is because it actually is pain in the neck that's referred into the head. So a cervicogenic headache is this type of headache. And it, like I said, it starts in the neck, it goes up into the head, and it feels like this deep ache on the side of your head. Sometimes it goes into the face, temple, around the ear area, but again, it's starting in the neck. And people who have cervicogenic headaches oftentimes also have a history of car accidents, concussions, or contact sports. The third type of headache is probably one that you've heard about because it's exceptionally common. 1 in 5 women have them, 1 in 15 men have them, and those are migraine headaches. Migraine headaches, like cervicogenic headaches, are going to be on one side of the head, but they're this deep, throbbing, pulsating feel that people often also have a sensory sensitivity with. So they'll be sensitive to light, they'll be sensitive to smell or taste or sound as well. And the triggers for a migraine headache, man, that list is super long. So migraine headaches can be triggered by just about everything, it seems like. Anything from hydration issues to nutritional intake that people are having, or even hormones within their own body. So migraine headaches can sometimes be really difficult to treat. And in addition to that, they can also be exceptionally debilitating for the people who have them. So it's a really big issue to have a migraine headache. The fourth type of headache is one that I've experienced myself in life, and that's called a cluster headache. It's more common in men, and it's actually caused by irritation along what's called the trigeminal nerve that brings sensory to the face, okay? Now, a cluster headache is going to be this deep, throbbing, aching pain behind one eye. And oftentimes, someone will also have a tearing that happens as well with that. Cluster headaches can actually be linked to changes in time. So daylight saving time can be a trigger for some people who have cluster headaches, which is really interesting, right? They can be exceptionally debilitating, and on average, a person experiencing cluster headaches might go as much as 6 years without an affirmative diagnosis of them. So that's it for me today. I really hope that you've learned something about headaches, as well as how to identify the type of headache you have so that you can get the right type of care for that headache. And if you've been having headaches, please give me a call so that we can identify the type of headache you're having, and we can identify the best course of action to get you some relief from those headaches so that you can go back to the life that you want and that matters to you. So like always, please like, share, and follow this video so that other people can get this information as well. And I always have a great time talking with you, and I'll see you next time.